Hello, I'm Dr. Vasileios Katsaridis. I'm a neurosurgeon at the European Interbalkan Medical Center in Thessaloniki, Greece. As a neurosurgeon, I treat surgically all diseases of the central nervous system, including brain tumors and spine disorders. But I have a special interest and a specialization in the treatment of vascular disorders of the brain. These disorders include brain aneurysms and arteriovenous malformations. The modern treatment for these diseases in the last few decades is embolization. The traditional treatment was craniotomy, opening the skull and reaching the brain and treating the problem microsurgically. Embolization is a less invasive method that is performed with microcatheters entering the arteries of the brain through a puncture of an artery in the leg, the femoral artery. With the use of special microcatheters and microguide wires, we can reach any part of the brain and treat most aneurysms. The way we treat aneurysms with this method is by putting a small microcatheter inside the aneurysm itself and pushing small microcoils made of platinum that fill the aneurysm and occlude it from the circulation. There are cases of very special aneurysms. This is due to their anatomic and morphologic variation that requires special techniques during the embolization procedures and the use of special materials. Here at the Interbalkan Medical Center, we have a great expertise in the use of these techniques and these materials, and I have also trained doctors in other countries in these procedures and the use of these materials. A very small percentage of aneurysms cannot be treated with embolization. We estimated about 5%. This was higher in previous years, and now with the modern techniques, it's less than 5% of aneurysms that we cannot treat with embolization, and these aneurysms can then be treated only with microsurgical open craniotomy procedures. Another disease that can be treated with the method of embolization is arteriovenous malformations of the brain, also known as angiomas of the brain. These are masses of abnormal arteries and veins in the brain that can cause rupture or compress the brain. These can also be treated with embolization. After reaching them with special microcatheters, we can inject special embolic materials that occludes this mass of vessels and cures the malformation. The techniques of embolization can also be used in cases of arterial stenosis, either in the carotids in the artery or even inside the brain, that are also very common and can cause ischemic stroke. In these cases, after reaching the stenotic part of the vessel, we perform angioplasty with balloons and also place special stents designed for endocranial use, and we open up the stenosis and reduce the risk for stroke. Many methods have evolved in the recent years, and materials came into use that we use every day. These include special microcatheters, special stents, and even flow diverters that are the modern trend in treating brain aneurysms. All these procedures are performed in the European Interbalkan Medical Center in Thessaloniki, and I have a great experience in treating aneurysms since I have treated personally more than 3,500 cases. This personal experience with large numbers of treated aneurysms is one of the largest in Europe, and combined with the organization and the facilities of the European Interbalkan Medical Center, creates a center of excellence for the treatment of arteriovenous malformations and brain aneurysms, one of the best in Europe.